A silent crisis is unfolding, one that has started in distant villages in Africa but could soon knock on America's door. And much of it is the result of U.S. cuts to foreign aid funding. Programs that once kept deadly diseases in check are being rolled back, just as outbreaks of Ebola, mpox, and Marburg are on the rise. Michael Baleke reports from Africa's fight to save lives with limited resources.
A rare moment of hope here at Mulago, Uganda's National Referral Hospital. 7 survivors just cleared of Ebola walk free.
At some point, I felt life was going. But with faith and my supporting family, with the team around, whom I believed in so much, because that was the only option left, I happen to have been one of the survivors talking to you right now.
But for many people outside these hospital walls, the fight for their lives is far from over. Uganda is in the midst of its 6th outbreak of Sudan virus disease, a highly fatal type of Ebola. Since January, there have been 12 confirmed cases. 2 people have died. But unlike previous outbreaks, Uganda has fewer resources now. Labs are stretched thin and health teams are struggling to cope.
Many of us are very much aware that partners are withdrawing. So partner funding is dwindling. And the best message ever is prevention, prevention, and prevention. So all of us must rise up to the fact that we must prevent.
In January, the U.S. government under President Donald Trump announced a near total freeze on USAID programs in a bid to slash overseas spending. Its impact was nearly immediate, hitting here in Africa, including its battle against hemorrhagic fevers. In Tanzania, the Marburg virus, Ebola's equally deadly cousin, has killed 10 people. The fear is that viral outbreaks like this may emerge and spread at a time when U.S. assistance and information sharing are no longer accessible.
What might start as a pandemic here can easily spread to other parts of the world, as we saw with the COVID pandemic. So being too territorial in thinking of only our country, it might look fine in the immediate terms, but in the long term, it's potentially very risky.
The world is already witnessing that risk with a multi-country mpox outbreak underway in Africa. Sheila Simwe is a survivor in Uganda.
Ngamba kirabikana musuna era measles watusinkana abantu banjawulo. Karuni nkera na yino genda mu ddwaliro. Mama yo nafuna first aid mu clinic kijja kuba fine. Ate we yango banichindeetera okutyama. Ane ba neighbors batandise okungamba tosemberera ntishira. Situation ogiraba. Ngenda ko mikwano jange n'embagamba ne bangamba.
The number of confirmed mpox cases in Uganda so far this year is already twice what it was the whole of last year. According to the World Health Organization, 20 of them were fatal. To the west, the Democratic Republic of Congo has it worse. More than 18,000 cases have been confirmed and at least 47 deaths, according to UN reports. But the Africa CDC warns the true toll may be far higher due to gaps in disease monitoring and lab testing.
When it comes to humanitarian response in DRC, US funding is a big part of it. We have estimated what we call our humanitarian response plan. US funding accounts for more than 70% of our funding. So you can imagine how this can directly or indirectly affect responses on the ground.
Mpox cases are largely concentrated in African countries, but not limited to the continent. Scientists from the University of Surrey in the UK say mutations in the virus are increasing its severity, raising the risk of a global pandemic. This isn't just Africa's problem, it is a global one. Cases have been reported and confirmed in at least 3 US states so far this year: Georgia, New Hampshire, and New York, from people who had traveled there after visiting areas here. Travel-associated cases have also been reported as far away as in Brazil, Canada, China, Sweden, and Thailand. Whether it's COVID-19 or Ebola, HIV, or tuberculosis, Global health experts say this goes to show how infectious diseases defy borders and how a decision made in one part of the world can have health ramifications far and wide, regardless of where the outbreak originates. Baleke reporting for CNA in Kampala, Uganda.